we just saw the different we just saw the pathway of the sympathetic supply of the eye. Now when the sympathetic supply of the eye of one side is affected, when the function is lost, it, we get Horner's syndrome. We get Horner's syndrome. Okay. Now, as we have just discussed the pathway, let us first study the lesions, then we will see what the features of presentation are. So, first lesion is in the first order neuron. So, the lesion in the first order neuron. So, let us first look at the lesion in the first order neuron. So, when the lesion is in the first order neuron, the first order neuron is from the posterior hypothalamus to the ciliospinal bulge. So, I'll just mention one or two more common conditions. So, first one, it can be a brain stem lesion. Can be a brain stem lesion. So, first one, it can be a brain stem lesion. Uh, or it can be like any stroke syndrome, like one stroke syndrome, like lateral medullary syndrome. It can be a lateral medullary syndrome or Wallenberg syndrome. So in case of lateral medullary syndrome, I'll just show. So you can see here. Uh, this is a cross section through the medulla. In that, you can see here you have descending sympathetic tract. So when this part is getting involved, it is the lateral medullary syndrome. So when this part is getting involved, it is the lateral medullary syndrome. It is mostly pica or posterior inferior cerebellar artery or the vertebral artery involvement that occurs. So that is pica. So lateral medullary syndrome is seen there. In that case, when the sympathetics are involved, you can get Horner's syndrome. Now, that is the first cause, brainstem lesion. Next is syringomyelia. Involvement of the spinal cord. Again, third one is diabetic neuropathy. So, diabetic neuropathy. So, these are some of the causes of Horner syndrome when the first order neuron is involved. Right. It's the central Horner syndrome. So from the ciliospinal bud starts the second order neuron. So in the earlier picture I have showed, here near to it you are having the lung as well as the subclavian artery. So from here we can derive the two causes. This is a very important tumor, Pankos tumor. So in many questions you will be able to see Pankos tumor with Horner syndrome, associated with Horner syndrome. Secondly, subclavian aneurysms dissections. Subclavian aneurysm. Then you can have neck lesions like thyroid tumors. Example, thyroid tumors. You can have neck lesions, example thyroid tumor, enlarged lymph node, traumatic lesions. You can have spinal cord lesion. So spinal cord lesion. So Pankos tumor, subclavian aneurysm, neck lesion, spinal cord lesion. This is very, very important. Pankos tumor. So after that, it will reach the superior cervical ganglion, and from the superior cervical ganglion it is ascending along with the internal carotid artery into the it will go into the cavernous sinus, and from the cavernous sinus, it will exit along with the internal carotid artery. It will enter the nasociliary as well as the long ciliary nerve, nasociliary and long ciliary nerve, and it will reach here. So now the postganglionic, when is the in what lesions are the postganglionic fibers involved? So the tertiary postganglionic fibers are involved, of course, in ICA aneurysm. So in some cavernous, carotid and aortic aneurysms, this can also be involved. Okay, carotid and aortic aneurysms. In some carotid and aortic aneurysms, this can be involved. So here you have ICA aneurysms. Second one. Next is nasopharyngeal carcinoma. Nasopharyngeal carcinoma. So in 38% of the cases of nasopharyngeal carcinoma, you can have what ophthalmic manifestation or a neuroophthalmology manifestation, and 16% of the cases in nasopharyngeal carcinoma, the neuroophthalmological manifestation is the earliest sign. So it is very critical to identify this and diagnose the cancer then and there, so that you can treat it with radiation therapy. So the most commonly involved nerve are fifth and sixth, the abducent. So the abducent is getting involved. So fifth as well as the sixth is getting involved. The sixth nerve, along with the Horner's syndrome, is one common presentation of this nasopharyngeal carcinoma, one of the earliest presentation. So the sixth nerve involvement along with the Horner's syndrome can come as a presentation. In the case of nasopharyngeal, in those the third order neurons are getting affected. Okay. Next, yeah, it is passing through the cavernous sinus. So cavernous sinus lesions, like any tumors in it, or cavernous sinus lesions. Pituitary tumors, of course, pituitary tumors. So nasopharyngeal carcinoma, like, so skull base lesions. So whatever lesions you have at skull base lesions are an important cause. Then also cluster headache, one type of headache, that is cluster headache, is an important cause. So these are the main causes of the Horner's syndrome.